Pregnant or trying to conceive, here's what your OB wants you to really know about the first trimester. 1. You don't need an ultrasound right away. We typically recommend your first ultrasound to be between weeks 7 to 8. Earlier ultrasounds can cause unnecessary anxiety and worry, and typically we don't see things super early on in pregnancy. That's why the recommendation is 7 to 8 weeks, unless you have high-risk factors or your OB recommends otherwise. 2. Cramping and light spotting in early pregnancy is so common and normal. During those first few weeks of pregnancy when implantation is occurring, it can cause discomfort and it can cause menstrual-like cramping with some light pink or brown spotting. So if this happened to you, there's no need to panic, but always remember that heavy vaginal bleeding or significant cramping and pelvic pain is never normal, so you should always call your OB/GYN if you have any concern. 3. You don't need to be eating for 2, especially in the first trimester. In the first trimester, in those first few weeks, your caloric intake should not change. It's okay if you're surviving on nothing but toast, crackers, and ginger ale for those first few weeks. We have all been there and there is no judgment. Survival is sometimes just so important. It's important to just focus on good nutrition and staying really well hydrated. And 5, starting a prenatal vitamin as soon as you find out you're pregnant. I'm talking like the minute you get a positive pregnancy test, you should be starting those prenatal vitamins. We actually recommend starting them as soon as you start trying to conceive because it's so important to have those nutrients and have those vitamins on board as early as possible. Save this video if you're newly pregnant or you're in your trying to conceive era and send it to someone who you think would benefit from it.